Today's video I'll be mainly discussing about the pharmacology of an anti-ulcerant drug which is sucralfate. So students and viewers, beginning with, sucralfate belongs to the category of drug which is called as the anti-ulcerants. Why? Because sucralfate is mostly given to the patients who are suffering from gastric ulcers or duodenal ulcers because it is an ulcer protecting drug. It helps finally in the healing of the ulcer. So what it does is, looking at the mechanism of action of sucralfate, what sucralfate does at the gastric pH, it forms a sticky viscid gel that gets adhered, that gets attached to the base of the ulcer and thereby acting as a physical barrier, thus protecting the ulcer from the contact of the acids and the enzymes and the hydrochloric acid which is being secreted by the gastric mucosa. So finally, in this way, sucralfate exerts its mechanism of action. It binds to the base of the ulcer, thereby preventing the direct contact of the gastric juices, the gastric enzymes, as well as the pepsin, the hydrochloric acid, the gastric acids what are being secreted, ultimately shielding off the ulcer from the corroding effects of these gastric juices, gastric acids. Apart from this, it stimulates the synthesis of prostaglandins. Sucralfate, what it does, it is stimulating the synthesis of prostaglandins from the gastric mucosa. So from the gastric mucosa, the prostaglandin synthesis will be stimulated, and once the prostaglandin synthesis is being stimulated by the action of sucralfate, what it is going to do is it is going to inhibit the secretion of gastric acids as well as increase the production of the mucus. All right, so it helps in the inhibition of gastric acid, it helps in the inhibition of the gastric acid secretion, as well as it increases the mucus production, mucosa production of the it increases the mucosa production in the gastric mucosa. So ultimately, since the inhibition of the gastric acids has taken place, as well as increase in the mucus production is there, so ultimately that is going to have a protective influence, a protective effect on the gastric mucosa, and protects the cells in the gastric mucosa. So this is how sucralfate, the mechanism of action of sucralfate is there, how sucralfate exerts its mechanism of action, and finally it leads the action, these actions leads to the healing of the ulcers what are found in the duodenum or. So when we look at the dosage, what are there? So basically, sucralfate is available in the market in the form of either suspension is there in the suspension form or in the tablet form. When talking of suspension, each 10 ml of the sucralfate suspension is containing 1 gram of sucralfate, as well as 1 gram tablets of sucralfate is also 1 gram tablets of sucralfate is also available in the market. So basically, when we look at the dosage, so doctors prescribe each tablet is to be given 1 hour before food during the morning as well as at bedtime at night for 4 to 8 weeks. So this dosage is being recommended by the physicians. Apart from this, once the ulcer has healed, the healing has taken place, the ulcers have healed, so a maintenance dose is given by the doctors, that is 1 gram sucralfate tablet twice a day, that is BD, for 6 months as a maintenance course. So students and viewers, this was a very short discussion where I've discussed the pharmacology of one of the very important anti-ulcerant drugs, that is sucralfate. Students, if you like this video, give this video a thumbs up, and those students who are new to my channel, who haven't subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up, and don't forget to share it amongst your friends. Thank you for watching.